Hello, everyone, and welcome to HeadWise, the weekly videocast and podcast of the National Headache Foundation. I'm Dr. Lindsay Weitzel. I am the founder of Migraine Nation, and I have a history of chronic and daily migraine that began at the age of 4. I am super excited and honored today because I am here again with Dr. Dawn Buse. Hi, Dr. Buse. How are you?
Hi, Dr. Weitzel, and hi, everyone watching this podcast.
So Dr. Buse is a regular. Many of you know who she is. She is a clinical professor of neurology and a psychologist who specializes in headache. We love having her on. She is so knowledgeable and everyone loves hearing what she has to say. She also makes me very happy and makes my job so easy. So let's chat with her today. We have a very practical episode today. We're not talking about new data. We are here because we want to talk about depression and low mood and how that coincides and is a comorbidity associated with migraine and head pain. And we want it to be very practical. We're doing sort of a checkup. For people, I think all of us, it can sneak in if we have chronic migraine especially, and we might just not be feeling as great as we could. And so this is just a really great episode where we can check in on ourselves, see if we think it's a problem, and see what we can do about it. So Dr. Buse, first of all, in case anyone doesn't know who you are, can you just go ahead and introduce yourself and why you do what you do?
Well, yes, as you said so nicely, Lindsay, I am a psychologist, and I've really worked all of my career with people with migraine, other severe headache, as well as chronic pain, and helped people both in office, actually in my office clinically, working on things like biofeedback, cognitive behavioral therapy, relaxation therapies, and the other flip side of the coin is I get to do research, and our research studies are often massive. So working with people, for example, in the Overcome study with 60,000 respondents, and working on other studies of really large scale, where we also learn a lot about life with migraine. How does migraine affect school and work and parenting and finances? How does migraine affect mood? And the flip side of that is how do mood and other kinds of comorbidities affect life with migraine. So I'm really, really lucky that I get to have both of these experiences, the one-on-one experiences in the office and the research experiences with the really large scale numbers of respondents. And what always amazes me is how aligned or at least harmonizing the responses are from the one individual in the office to 60,000 people out in the country, out in the world living with migraine. So from what people living with migraine have shared with us, we like to kind of synthesize all that information and bring it back to you who are watching, whether it's you yourself living with migraine or a loved one, so that we can use information gained from these big research studies to help you live better lives.
Well, we are all so grateful for what you do. Your research really helps us, and we love what you do, and we hope you keep doing it, and just thank you so much. So let's start with a very obvious question first. Is it just considered normal to feel down and depressed if you suffer from migraine or really any sort of chronic pain?
Well, if we're going to define normal as common, as the majority of people, the answer is going to be yes. So migraine and depression are buddies, unfortunately. They travel together. Some really interesting research by Naomi Breslau and Richard Lipton showed that people who had migraine were about 5 times as likely to develop depression as people who didn't have migraine. But interestingly, it can go in the other direction. People who had depression first over the next 10 years were also about 3 times more likely to have migraine emerge. So this doesn't mean that one causes the other necessarily. It could be that one causes the other. It could be that they both cause each other. But we think probably it's more of a shared underlying etiology or reason. The neurochemicals that work in the brain and the nervous system are some of them are the same for depression and migraine. They work on some of the same neurochemicals. There's a lot of similar risk factors, both genetic. Both of these conditions travel in families,
Right.
as well as social and environmental, like being exposed to trauma, having adverse childhood experiences, living in war-torn countries. So there's a lot of shared reason, as opposed, in addition to the obvious, this is hard. This is not easy to live life
Right.
with a unrelenting, painful, surprising condition that comes out of the blue and knocks you out and takes away your life for hours and days at a time. So it's very logical on a bunch of reasons. And yes, they are comorbid. And
Yes.
comorbid, as you've all heard me say before, means that things occur more likely than by chance, but means that depression and migraine really do occur together. So in our population studies of people in the United States or people around the world, we find that maybe 20 or 30% of people living with migraine have depression at any given time. And that's the full diagnostic criteria. But a much higher percentage of people at any time could be feeling those symptoms, feeling
Right.
down, feeling hopeless, feeling helpless, feeling blue, just feeling blah, feeling like they don't want to see people, don't want to go out, those sorts of things. So we'll
Right.
talk a little bit more as we go forward about the whole enchilada, meeting the diagnostic criteria and having a diagnosis, as well as the symptoms.
Right. And I can say, I feel like interjecting here as someone that has been, dealing with chronic or daily migraine and head pain for over 40 years. It is a daily thing, and you do get better at seeing those symptoms of, oh, I'm a little down. I need to do a little something about it here, but I do think it's sneaky. And so one of the reasons I wanted to record this episode was that I feel that a lot of us with chronic migraine might start to get down and not notice it and just kind of go into survival mode and may not notice that we've become depressed over a period of time. So what is it that we need to be on the lookout for?
Sure. The first two symptoms of depression, if we were to look at the diagnostic criteria, one is feeling down, depressed, or blue. We all know what that feels like. But the second kind of sneaky symptom is called anhedonia. It means not enjoying things you usually enjoy. So this is when people don't really maybe want to go out, maybe don't want to
Yeah.
see friends or family, maybe don't want to make social plans, or don't enjoy things they used to enjoy, whatever that hobby may be, a sport, a volunteer activity, dancing, going to baseball games, whatever that hobby may be, they just don't have the interest and energy to do it anymore. So I often like to actually start by asking about what someone's been doing and are they enjoying it? So how's are you still building that canoe? Are you still
Yeah.
volunteering at the animal shelter? Are you still training for that half marathon? That's a big clue.
Yeah.
As we start to feel down and depressed, we don't really have that energy and interest to kind of start to do those things outside and outside of ourselves, outside of our home, outside of our regular routine of what we have to do. So those things, those choices will kind of fall away and
Right.
life will start to get smaller.
Can I ask you a question? What do you think when people say then that the reason they stopped doing those things is they couldn't plan anymore because everything was being canceled because of migraine? So they
Right.
think
Well,
it's the
that is
pain. They're
a
not sure if
very
it's the pain
valid.
or the sadness. Right.
Well, and that's a very valid reason too.
Right.
This is a really, really common experience for people living with migraine or other chronic episodic diseases. So things that go on, but they happen every once in a while. It really makes making plans hard. And not everyone in the world understands, and not everyone's nice about it. So friends or family or coworkers or whomever is in your circle may have not been understanding about it. You may start to get labeled as, oh, so and so never shows up, or he's always late, or she always leaves early, or that person always cancels. It may be that people start to plan without you. That happens. Or say, oh, we didn't think you'd be able to make it anyway, which only makes these feelings of sadness and guilt and frustration worse. So
Right.
this is very common. And you and I have talked about anxiety before separately. This
Hmm.
is also very related to anxiety. We actually have a term for it. We call it interictal anxiety because we call
Hmm.
the migraine attacks the ictus, a medical
Hmm.
term. So the time between attacks, this anxiety increases and people worry, should I make plans? Can I make plans? Can I make commitments? What should I do? And anxiety and depression are very complementary to each other.
Hmm.
They share several symptoms as well as they often travel together. Some
Hmm.
people may feel one more strongly than the other, and
Hmm.
some people may feel both pretty strongly. But let's talk about a few more of the depression
Yes.
symptoms. I'll let
Sorry.
you know
So thank
which
you
one.
for answering that. Go ahead. Continue.
Absolutely. Well, I always love
Mhm.
talking to you. This is great. I wish that everyone listening could be here and chime in too, because
Yeah.
there's so many different experiences, and yet so many of them converge when you start to talk
Hmm.
to other people living with migraine or other
Hmm.
chronic episodic illnesses. So some of the other depression symptoms can be eating too much
Hmm.
or losing your appetite completely. And
Hmm.
it seems to be whichever we don't really want. So some people who may feel like they're already maybe on the lower body weight side, maybe the ones that lose their appetite. And some people may
Hmm.
think, oh, I probably should lower my weight a little bit, might be the ones who kind of comfort eat. So eating
Hmm.
too much or too little, and it's usually not the direction we're hoping for. Sleeping too much, kind of
Hmm.
just all the time, or not getting out of that mode. Even if you're not in bed asleep, maybe you're still kind of in your pajamas or your lounge wear all day and not feeling like really getting up and at them and not going out and doing things. um,
Yes.
or having a hard time sleeping, this
Hmm.
insomnia, because you're thinking about things, you have a lot of worries, anxieties, maybe your self-talk is very negative, maybe you're feeling very guilty or hopeless or helpless. So
Hmm.
eating too much too little, sleeping too much too little, very low energy,
Hmm.
and feelings of like feeling that the future is looking hopeless, that's not going to get better,
Hmm.
feeling helpless, that there's nothing you can do about it to make it better, and feeling guilty. Now, we
Hmm.
all know, and you and I will say till the cows come home, that migraine, cluster, new deadly persistent headache, tendon type headache, all of them, they're not your fault.
Nope.
They're coming from some biochemical things happening in your brain and your nervous system. They're not your fault. You're not causing them. And yet, people will feel very guilty when they have to cancel an event or leave early, or miss out, or feel like they're letting their kids down, their coworkers
Hmm.
down. Boy, that guilt just rushes right in there, and people feel that they're not handling it well enough. But
Hmm.
we're talking about a kind of neurochemical storm of pain, sometimes nausea, sensitivity to light, sound, smells, fatigue, cognitive interference, difficulty thinking. This is rough. This is
Hmm.
really rough. And
Hmm.
this is not easy for anyone to get through. And yet the
Mm-mm.
depression monster over here is going to say, well, this is your fault. You're too weak. You're not strong enough. You should
Right.
handle this better. And
Right.
that negative self-talk from that depression monster is going to get going,
Right.
kind of get you in this spiral.
Right. But I always say be gentle on yourself, and go back and remember all the things you did do. Like, oh my goodness, like there's so many things I actually did accomplish today, and all I'm noticing are the things I didn't. And I think that's such an important thing, because I feel like the migraine always just wants you to be so negative. It's a monster, it's a beast, and that's what it does.
Very true. I really like the
Uh-huh.
way you put that. I
Mhm.
think be gentle on yourself, like you said, is such
Mhm.
good advice. And I don't know that we can all do it. So,
Mhm.
but I think we can be kinder to other people. So I think, how would you talk to someone else who
Mhm.
had a disease or a condition beyond their control?
Right.
Someone with a broken leg, a broken arm, someone who's 8.5 months pregnant, someone who has
Mhm.
seizures, someone who has
Right.
something else, I think we would say, oh, wow, take care of yourself, take it easy, don't put that much pressure on yourself. We would understand for someone else going through a condition that was painful, where they were tired or they were having
Mm-hmm.
difficulties. And yet, when it comes to ourselves, we often have really high standards, despite the fact that we're working through these attacks that are really coming from the neurochemical reactions in the nervous system.
Right. So something I've always noticed is that some of the signs of depression are things that just sort of go along with having chronic migraine, like fatigue, aches and pains, difficulty concentrating, difficulty
Yeah.
sleeping. Do you have any hints for people who are having trouble telling if their symptoms are due to depression or due to the migraine and the pain itself?
Well, you tapped into a big research conundrum, Lindsay. So, as headache doctors have gone
Yeah.
around and around about this, just how I said that depression and migraine share several symptoms together, so do depression. I'm sorry, depression and anxiety share several symptoms, so do
Mm-hmm.
depression and migraine.
Right.
So, in fact, the criteria for depression line up with many of the migraine symptoms. You just mentioned quite a few of them.
Mm-hmm.
How do we tell what it's coming from? It doesn't even matter what it's
Right.
coming from. If it's all coming from serotonin and these chemicals and it causes both migraine and depression and maybe anxiety and maybe some other conditions, is it all coming from the same place? Well, one way that we might be able to tease it apart a little bit is if someone is meeting criteria for depression, they have a depression diagnosis,
Mm-hmm.
it's probably going to be present every day or most days.
Mm-hmm.
Whereas if it's really related to attacks and its symptomatology, it might travel more with attacks.
Okay.
And as a reminder, the migraine attack is longer than just the headache phase. We have
Mm-hmm.
a pre-headache phase, the prodrome, which could be a whole day of symptoms. Some people may have an aura. Your headache phase may go as long as 4 to 72 hours if untreated. And then you
Mm-hmm.
have a post-drome or post-headache phase, which could be another 24 hours. One of those post-drome symptoms is depression. Things
Mm-hmm.
have happened in your brain over that migraine attack that leave your brain in certain neurochemical state that you might feel tired. Sometimes
Mm-hmm.
people will say kind of a hungover kind of feeling, kind of wrung out. You might feel depression. You likely will feel some cognitive impairment actually through all of the phases. We've looked at when cognitive impairment happens, both in the Cameo study and the MyCoa study, and
Mm-hmm.
found that it's commonly reported through all of the phases, the
Mm-hmm.
prodrome, the pre-headache, the headache, the postdrome. So, like you said, it's a little tough to tease apart where things are coming from. But it might make people feel a little bit better if they think, oh, this is a symptom of my migraine, not that I have depression. Because
Right.
the idea of having depression comes along with a lot of stigma and
Right.
embarrassment, rather than
Right.
us thinking this is a neurochemical reaction that's happening in the brain and the nervous system. It feels like I'm personally not being as strong as I should.
Yeah. And I also, well, it's also interesting. I have noticed that there's been one or two times when someone will look at me and be like, "How long have you been in your pajamas?" And I'll be like, you know, and I'll think about it, I'll be like, am I feeling sad? Or is it because the pain's been higher than usual
Yeah.
for 2 days, and I don't know which it is. But that is one of the warning signs that I'm like, oh, okay, I definitely am feeling worse than usual because I have been in my pajamas a little longer than I
Yeah.
should. So it's kind of like you do have to notice the things where whether you're starting to feel down or it's the pain, or they go together. But it is funny. It's like, okay, well, maybe I'll change it to some other
Yeah.
pajamas. I don't know.
Yeah, we're gonna have to do a pajama episode, I think. Pajamas are a
Yeah,
bit of a hallmark
yeah,
of life with
yeah,
migraine or life with depression. And
yeah.
there's some times when getting cozy is absolutely the right thing to do. But
Yeah.
you're right, you're right. Those are real signs of depression, is not
Right.
really having the oomph to kind of get up and get dressed and get out of the
Yeah.
house and do your hair and makeup and whatever it is you might do,
Yeah.
or whatever it is that makes you feel good about yourself and feel like you, whatever
Right.
that is
Right.
a sign of depression. And interestingly, one of the homework exercises from cognitive behavioral therapy for depression is very much behavioral activation. Even though you don't feel like it, your homework is going to be getting dressed, doing whatever it
Mm-hmm.
is that you do to feel good about yourself, getting out and going to do something that feels like a pleasant activity, even if you don't want to do it right now.
Mm-hmm.
So fake it till you make it. You actually walk the walk of doing these things that you usually do when you're feeling better, when you're feeling like
Right.
yourself. You do that in hopes that the mood will follow. And
Right.
it often does. There is magic in getting out of the house, in getting
Mm-hmm.
into the sunshine, in seeing people, in doing your favorite hobbies, doing your favorite things. It is one of the therapies that we use to help people get out of that depression cycle.
Right. So this is such an important question, and I think that everyone wonders about it, and it helps to have a somewhat of an answer at least. Does depression make migraine worse and vice versa?
Yes and yes. So as things are getting worse, they both get worse together. So rates of depression among people with migraine are higher when people have more headache days. They're higher, more people with moderate frequency episodic migraine, higher frequency episodic migraine than up to chronic have depression. So when we look into a headache clinic, people who are seeking care for their migraine, and we look at those with chronic migraine, we're seeing about 50 to 80% meeting criteria for depression. I don't want
Mm-hmm.
that to scare people. It does
Mm-hmm.
sound a little scary, like, oh gosh, this is really
Mm-hmm.
bad. Um, but like we said, they share symptoms, they share etiology. As
Mm-hmm.
they would increase, it's very logical they would increase together. The opposite good news is that all the studies show that as you improve migraine, as you lower the number of headache days,
Mm-hmm.
depression goes right down with it.
Mm-hmm.
We have studies from cognitive behavioral therapy. We have studies using CGRP targeted MABs. We have studies using onabotulinum toxin A. Doesn't matter what the therapy is. It looks like if you can improve migraine, depression does tend to reduce with it right alongside. So yeah, they
Mm-hmm.
travel together. When we think about progression, so someone who has episodic migraine in 1 year and then has chronic migraine in the future, the next year,
Mm-hmm.
that is related to not only having depression at all, but the severity of depression. So
Mm-hmm.
someone with severe depression and episodic migraine is much more likely than someone without to have chronic migraine the next year. So their
Mm-hmm.
migraine might be increasing. However, with all these conversations, keep in mind it's probably not a chicken or the egg.
Right.
There's something going on underneath that's causing both of those to just
Right.
go up together. And then if
Yeah.
we turn them around, if we can treat either one, the other one tends to get better too. They tend to kind of travel together,
I think
which
that's
is a
important.
great
Yeah.
for why we need to treat migraine, we need to treat depression, we need to treat everything, get everyone out there living their best life and feeling the best that they can.
I think that's very important. And I'm guessing we have a lot of parents out there that have kids that also have migraine that are listening. And one of the reasons I ask that is in my family, we go daily so young, and my 9-year-old son has daily migraine. And it was really, he's not doing well right now. It was really bringing me down. And the one thing that was in my mind was that if I get down or if I get sicker, who's going to take care of him? And so I've been doubly focusing on taking care of my mood and my pain. I don't want either of those to get worse because I have to be here for him. So that was one of those things that was really on my mind. That's why I threw that question in there. Is gosh, I've been thinking of the parents so much lately. It's, your oxygen mask on first kind of a thing. We all have to keep our moods up, and hopefully that helps keep our migraine better
Uh,
too. So let's
it's
talk.
so true.
Go
As a
ahead.
mother with migraine, you're not only trying
Yeah.
to get through yourself, but you're
Yeah.
worried about your kiddos and taking care of all that they need.
Yeah.
Same thing, people feel that way about their spouses, or maybe they're caring for
Mm-hmm.
seniors, or maybe they're caring for an adult family member who needs help. And so not only are you trying to like hold on to your own life vest there. You're like also caring for other people. Here's
Right.
one good news. It is really helpful to lift some of those depression symptoms to think about someone else, even to worry about someone
Mm-hmm.
else, to care about someone else. Whenever you kind of get out of your own head and focus on something else, you get busy, you got things to get done, you have things to accomplish. It's actually helpful for depression.
Mm-hmm.
So the fact that you're thinking of your child
Mm-hmm.
is not only natural and very lovely, but it kind of keeps you going. It keeps you on
Yeah.
your track. It keeps you on your purpose. And
Mm-hmm.
depression, again, that helpless and hopeless, depression steals away your purpose. It steals away your
Mm-hmm.
drive. It
Mm-hmm.
steals away your sense of confidence. So
Mm-hmm.
everything you can do that's opposite
Right.
uh, is really good for you.
Right. So let's talk about what works for depression in the setting of migraine. What helps bring us up? What are the best things we can do to help ourselves once we realize we're starting to go down, or we do have these signs of clinical depression, as you mentioned? What can we do?
Well, a good place to start for everyone with migraine, whether they have depression or not, or everyone with depression, whether they have migraine or not, are going to be those kind of half a dozen healthy lifestyle habits that we talk about a lot. Are you getting enough good quality sleep? I would say I'm not. I would say most of us are not. I'm a parent. I've got my kids
Mm-hmm.
waking me up all night. What can you do to improve your sleep? That can help a lot. It can help
Mm-hmm.
depression, anxiety, migraine, weight. It can help so many things. Are you exercising? And if you're
Mm-hmm.
not getting enough exercise, can you think about just, are you moving enough? You don't even have to think
Mm-hmm.
about exercise. Are you moving enough? Are you getting
Mm-hmm.
out? Are you taking walks? Are you working in the garden? Are you XYZ? You
Mm-hmm.
got to move your body. And
Mm-hmm.
that can be really hard with migraine
Mm-hmm.
and with pain and with depression. All
Mm-hmm.
those things are going to fight against wanting to move. You got to check on your movement, see if that's up to where it needs to be. Are you getting outside? Are you getting sunlight? Are you seeing green spaces? Those are all really important for humans and animals. Those are important for every living creature, and we are living
Mm-hmm.
creatures. You got to get out and about, get the sunshine, see some green when you can. Even if you live in a city, get out and breathe the air, look at the blue sky, look at the little flowers in between the cracks of the sidewalk there. Try to get to some space that kind of feeds your soul. How's your diet?
Okay.
Healthy enough? Are you kind of avoiding the processed foods, trying to keep a balance of the healthy fats? That's the number one important kind of diet issue for people with migraine,
Mm-hmm.
and also healthy for depression as well. Are you staying hydrated? So those are our big kind of lifestyle things that we talk about all the time. And we always talk about, for everyone with migraine or any type of headache disease, are you managing stress? We
Mm-hmm.
can't always stop the waves from coming. We can't control what's happening out there in the world or what happens to us. We can kind of try to control how we react to it, what it does to us. And that's going to be something that you're going to work on in cognitive behavioral therapy, the mindfulness-based therapies. It's a lot of ways to work on that. So those are the
Mm-hmm.
places to start. Check on your lifestyle habits, do a little lifestyle check there. Are you healthy enough? What do we need to rebalance?
Right.
Have a deficit in any of those areas, you can talk to your primary care professional. Things like if you're not getting enough sleep or you're not getting enough sunlight, it's winter and you're feeling the depression come in, talk to your
Right.
primary care professional, maybe do some light therapy. You could do that at home, all sorts of ideas. From that, the next level, the real go-to is going to be the really scientifically validated therapies. There are some that help both depression and migraine, like
Okay.
cognitive behavioral therapy,
Mm-hmm.
the mindfulness-based therapies. There's two different kinds. There's mindfulness-based cognitive therapy and mindfulness-based stress reduction, acceptance and commitment therapy. There's EMDR. There's probably about 6 or so therapies that are all kind of in the cognitive behavioral therapy family.
Mm-hmm.
DBT, dialectic behavior therapy. I would say choose any of those that you're interested in. They can find a provider, that sort of thing.
Right.
Choose any of those in that family. They all have good evidence for improving depression and the CBT is going to do the behavioral activation, the
Mm,
stress management, the helping us think about the ways that we think about and view the world, improving our coping skills. Even if you've done CBT before in the past, it's always good to get a refresher. Things in your life may
right.
be different now than where you were before. And you can go see someone who does CBT for depression. They don't have to be a provider who sees someone with migraine or other severe headache the way I do. And they can
Mm-hmm.
still teach you those skills and those concepts. You can still get the benefits, a lot of
Mm-hmm.
benefits to both depression and migraine, as well as anxiety and other headache diseases. And then
Right.
the next level after that, and I'm going to say it in order, everyone do lifestyle, think about your therapies, your behavioral therapies, and also biofeedback too is
Right.
terrific. Biofeedback and relaxation in those behavioral therapies.
Mm-hmm.
And then you can talk to your doctor about medication. And we generally like to not think of medication for depression or anxiety long term. We think about them more short term because they
Mm-hmm.
can give someone, instill some more hope, make
Mm-hmm.
things feel more manageable, give them a little more energy, and they might be the right place to kind of start. They might
Mm-hmm.
help improve sleep and improve energy, kind of get you feeling a little better. And
Mm-hmm.
then you can start working on some of those lifestyle healthy habits and the behavioral therapies.
Right.
And generally, we're going to want to stay on those antidepressant medications. You're going to give them a good 3 months to see if they
Okay.
work. They ramp up slow, some of them, so we want to make sure they work. And then you might talk to your doctor at intervals. You might check in at 6 months and 9 months and 12 months. And for most people, they're going to have an ending time.
Okay.
And you can kind of come off, see how you're doing. And then if life happens and you go back on, trying to titrate up and down, that's just fine. But that's when you'll work with either your primary care professional or you might work with a mental health care professional on the
Okay.
medication.
Okay, so I'm glad you made the point about medications that, if you go that route, you're not necessarily on it for life. So I think that's something people are always curious about. But I'd like to go back to cognitive behavioral therapy, based therapies for a moment. People like to learn in different ways. They also have differing access to professionals, etc. What about apps or books? Are these a good place to start?
Yes,
Okay.
absolutely. There are both books and apps. There are
Okay.
more and more kind of mHealth or eHealth, being the electronic or mobile health solutions all the
Okay.
time, including apps that might be on a computer, smartphone, tablet, including reminders on wearables. There are quite a few ways today that you can start learning a lot of these skills, start testing out things, incorporating in your life for a very reasonable cost. And
Right.
of course, that's much easier and more convenient than having sessions with a healthcare professional. Now, if you get to a healthcare professional, that's really going to be probably the gold standard. You're going to get
Right.
longer time. It's going to be personalized for you. So that's going to be really nice if that's a possibility.
Mm-hmm.
Generally, for CBT, you would see a psychologist for anywhere between 6 to 12 sessions, usually
Mm-hmm.
about 45 or 50 minutes at a time. Usually you space them out by a week or two or so. And
Mm-hmm.
usually in between, you'll have some kind of homework exercises.
Okay.
You'll work on the behavioral activation, or you'll work on checking in on your thoughts and changing your thoughts, or
Okay.
you'll work on your stress management strategies. So it's an active approach,
Okay.
but it has an ending. It is not
Okay.
on and on. It's targeted, it's time limited. You get in, you really focus on something, kind of like training for a half marathon. You're really
Right.
focused on some specific goals, and then it ends and you kind of go on with your life.
Okay.
So that's a great option. And certainly, I would say to people, check out books and apps.
Okay.
And I have a favorite book that is I think it's less than $20. It's a really a
Mm-hmm.
reasonable price. It's called the Stress Reduction and Relaxation Workbook. It's in about the
Mm-hmm.
fifth edition, and it comes in a workbook. So you actually fill things in. And if
Mm-hmm.
you go through it and you really fill it out, you would really learn a lot of what I might teach you if you came and saw me for 12 sessions in my office. The workbook does a nice job of going through some of the big topic areas.
Right.
And there's also some wonderful workbooks by psychologists like Aaron Beck or David Barlow that have done a really nice job of making CBT accessible through a very reasonably low price, or even maybe free at the library books.
Right. I love that, because I do think, it seems like there's a longer and longer line to get into any sort of professional anymore. And so, if you want to start today, you can by downloading an app or reading. And then there is the Cadillac standard, if you are able and you find someone to talk to, awesome. So, but I love that we were able to go through all that. So I hope
one
that
more psychologist I want to mention is Martin Seligman. And if you look for his website, which is called Authentic Happiness, he offers a whole range of questionnaires, not only challenges, but also your strengths, thinking about resilience, thinking about thriving. He's a professor. He's a past president of the American Psychological Society, American Psychological Association, and he has a focus on strengths as well as what leads to depression. Exactly. And you heard me say helplessness and hopelessness many times. That's actually his theory, actually, from about probably 40 or 50 years ago now, how we understand depression. So he also has a great website that's worth checking out, and some terrific books. So there are ways to get started that may not take the same amount of time and cost if you're finding that it's too much commitment right now to start out with a psychologist or mental health professional.
Right. All right. Well, thank you so much. Is there anything else you'd like to add to our discussion today, Dr. Buse?
Yes. So we talked about that depression is normal, meaning it happens a lot with migraine. Don't be surprised and don't beat yourself up. But while it is common and typical, we don't want you to stay there. It is entirely treatable. There are many ways to move out of it, between therapy, medication, the healthy lifestyle habits, and skills you can learn on your own. So if you are feeling depressed, please know that there are quite a few things you can do which will help. Now, the trick is you're not going to feel like doing them, because that's what depression does. But however you can kind of feel that encouragement and stay connected to your purpose, whether it's a career you love, or being a parent, or being a partner, or being a spouse, or your volunteer work, remember what you're doing it for. Keep that goal in front of you and kind of push yourself through those early steps. And then as you start to feel better over time, it all becomes a little bit easier. So when you're in it, it can feel very dark, but there are many proven therapies which can help you. So please reach out, talk to your primary care professional, look on the NHF website. However you get started, just please get started caring for yourself.
Okay, well, thank you so much, Dr. Buse. And thank you everyone for listening in this week to HeadWise. Please join us again next week. Have a wonderful day.